Hi, I'm Dr. Culbertson, emergency resident at West Michigan. I have an interesting case with a 29-year-old female presenting to the emergency department with decreased visual acuity and black floaters in her left eye following an insidious progression of a febrile illness with associated myalgias, headache, and lymphadenopathy over a 4-week period. History revealed that she had eaten undercooked venison several weeks prior to her symptoms' onset. She was afebrile and neurologically intact without evidence of vitreal or retinal abnormalities on bedside ultrasound. By ophthalmology follow-up 2 days later, she developed left nasal visual field deficiency, and ophthalmology noted optic disc edema and steroid injections were initiated for presumed optic neuritis. Subsequently, an MRI was negative for MS and was referred to a retinal specialist, in which they identified focal active chorioneuritis confirmed with serum antibody titers for toxoplasmosis. If you look at the first image, it shows the ultra-wide field fundus picture with retinal whitening shown by the asterisk and the focal traction with the arrows consistent with an actochorioretinitis. There is a lack of adjacent corneal retinal scarring, which shows that this is a primary first-time infection versus a reoccurrent infection. The second picture, which is figure 3, shows a full thickness chorioretinitis and overlying hyperreflection with the dot showing the active infection, whereas in figure 2, the ultraviolet fundus shows a hyperautofluorescence of chorioretinal lesion consistent with an active infection. This is a very interesting case in my opinion because there's many people in Michigan who are avid hunters, and this could be a cause for their symptoms, especially with this case being in the height of COVID. Originally, the patient was concerned she had COVID, but with the symptoms not resolving and then having the eye symptoms, it was much more concerning, especially with toxoplasmosis chorioretinitis being one of the most frequent causes of infection. Uveitis affecting the posterior segment of the eye can cause severe vision loss, and if it's not treated in a timely fashion, could cause permanent damage. And in many cases, the most common cause is undercooked meat or water in the oocytes, which can be by the animal drinking the water and then carrying it, and then when you undercook the meat, can cause this infection. The classic retinal finding is headlight and fog sign noted by the focal retinitis viewed through the vitreous haze, therefore making this in many times a clinical diagnosis, with later on getting the antibody titers to confirm the diagnosis. This will require a 4 to 6 week course of Bactrim as first-line therapy for sight-threatening lesions. Other scenarios or refractory cases may require a regimen of azithromycin, leucovorin, daraprim, malrone, steroids, and if many cases where the infection is still lingering, may require clindamycin injection straight in the eye. You will require lifetime suppression anti-toxoplasmosis treatment in order to prevent reoccurrence. Thank you for your time, and hopefully you thought this case was very interesting.